Feelings like anxiety and sadness, social isolation, and, not being very motivated, that kind of stuff. It's all really, really normal. That's a normal part of everyday living. It's when those feelings get so extreme that you really can't function in life. You can't work, you can't get out of bed, you can't do the very basic, normal kind of stuff that you would normally be able to do. It's at that point that you might consider that you might have a mental health problem that needs some sort of treatment. People can develop mental health problems at any point in their life and in response to a whole variety of events. It could be a long, slow build-up from growing up in a very difficult atmosphere. It could be in response to a single, very traumatic event. 3.2 million people live with a mental health problem every day in Australia. Some of the things that can make us more prone to mental health problems are things like being homeless, having kind of substance or alcohol misuse, being under great stress, being treated really badly, having difficulties at work, major life events, that kind of thing. Mental health problems cost the Australian economy in excess of $20 billion a year. So if people are thinking they might be having a mental health problem, generally, unless it's an emergency, they would probably go to their GP and discuss it with their GP. Now, the general practitioner would then probably refer them for specialist treatment. That might be, say, counselling or psychological therapies. They might prescribe some kind of medication. And in extreme cases, if it were necessary, some sort of residential treatment or inpatient hospital treatment. In New South Wales, we have a statewide mental health line. The number for that is 1-800-011-511. Supporting people with mental health problems is a key concern for me and for North Coast Medicare Local. We do this in a number of ways. We offer direct services to people experiencing common mental health problems. We offer the same psychological counselling services for people with postnatal depression and suicide prevention services. We're also involved in bringing together a group of agencies to work on opening a new headspace, a youth mental health centre in Lismore, which we're very excited about. I want to see a region where the healthcare systems include mental health as part of the mainstream work, that it's not just some little ghetto on the outside there, that it's everybody's business and it's part of everyone's idea of health.